My name is Corinne Leverton and I work in the Learning, Training and Development Unit of Adult Care and Support in Cornwall. We work with some of the most vulnerable people in our communities, so people who need support with everyday life. They might need support getting washed and dressed in the morning, they might not be able to get outside their own houses, they might feel very isolated. Lots of people who might be vulnerable if not supported so that they can live a full and engaged life in society. Well, we've had some instances where vulnerable adults in Cornwall suffered abuse and neglect and been harmed. And we have loads of training programmes around how to make people feel safer. But some of that obviously wasn't going into people's practice because these things were still happening. And that was really the start of us knowing that we needed to do things differently. We really needed to try and support people's practice so that those types of things didn't happen again. And we felt we needed some expert help to do that and to offer us support and advice on how we could change what we do. Well, we've had quite a long-standing relationship with Plymouth University through our social work programme. They suggested a knowledge transfer partnership and that we could get somebody in as associate to work with us, but that person would also be supported by the university. We had a particular question that we wanted to answer, which was how can we make our training most effective so that we can support vulnerable people. And we delivered lots and lots of training where we work, but we don't really know how effective it was in practice.
We started to have a conversation about how might we work together more specifically on some of the issues that were troubling the council. And at the time there'd been a couple of major inquiries into failures in social care that resulted in a young man dying. A huge amount of effort, time and money was being spent on something that nobody knew was changing anything. And so this was an opportunity to actually get a focused area of activity. I think the starting point was to actually see what evidence there was around training, how best to do it.
So having the associate in, we were able to really look at the programmes that we were delivering. And then when the evidence came, we were able to manoeuvre them and change them so that they actually incorporated that. How can we give people the best shot of transferring this into their practice and therefore improve the lives of vulnerable adults in Cornwall?
Everyone's been on training that's had no impact at all on their practice. It isn't rare, but it is a nut that hasn't really ever been cracked. I think what we achieved was to really ingrain that it isn't all about just providing things, it's about asking if it is changing practice, and that is quite a big shift really in focus. We included some preparation work, so that included asking delegates to spend a bit of time, preferably with their managers as well, asking them what they hope to achieve from this training, how they'd met the prerequisites as well, how they would implement any new learning in practice too, so even planning out that sort of implementation plan in advance of them attending, and really sort of questioning why it's important.
What Lindsay helped to develop was a set of principles that then could be applied in a whole range of different contexts. So the council has a set of tools, if you wish, by which it then designs its training. There are a lot of people, a growing number of people in society who need increasing levels of support in their daily lives, and it's incredibly important that that support is of the highest quality that we can deliver. And this training helps create the culture by which those people get the best quality support.
I think what it really has done for us is given us the confidence to say what we believe in now, rather than hoping it's true. We have that evidence now to back it up. And I think we're much more able to challenge the way things are done because we feel as though we have the knowledge to be able to do that. We're dealing with people who are very vulnerable, people not tasks. You know, that's me in a few years' time, and that could be any one of us, so it's really important that we do get it right.